guys, my name is Caitlin Caplet. I'm 24 years old from the Worcester area. I graduated from Worcester State in 2022 with my BSN, and I'm in the FNP track. I currently work at a level 1 trauma center in Worcester on the neurotrauma unit. It's also the only stroke certified hospital in the area, so I see a lot of that population on my floor, and how the lack of emphasis and access to primary and preventative care has created an overflow of these types of patients, not just neuro, but all patients who have had such devastating, debilitating injuries such as strokes that could have very well been prevented by addressing and with access to primary care to manage their risk factors and get them under control. That's what kind of drove my passion to embark on this NP journey on the PCP route. I also work on the other side of nursing in aesthetic medicine as a nurse injector at a med spa. Definitely a big contrast between the two jobs. It's crazy and often disappointing that sometimes I receive more respect from patients on the elective cosmetic side than I do within the acute care bedside nursing side. Although I've never been involved in politics or policy, working throughout COVID and at a hospital that's been over max capacity just about for off and on for 2 years straight, with a now extension unit being built because we have such an overflow of patients, it's opened my eyes to a lot of the issues within our healthcare system. On our floor, majority of the patients are unable to be discharged home with either debilitating brain injuries that cause them to need total care, or they just lack capacity. The hospitals are bursting at the seams due to the lack of continuing care and rehab, as well as the lack of insurance and how long it takes to get someone out of the hospital without insurance. And these people without insurance have difficulty accessing that primary care. Sometimes patients stay on our unit for months. We've had some over a year, over 2 years even, because there's simply nowhere else for them to go. But on the same end, there's nowhere for people to receive emergency services. So they're just bursting at the seams. But oftentimes, over 100 patients at UMass will need beds, and every hallway or every alcove throughout the hospital is lined with patients. Beyond that, I see just how many patients have no primary care and how the hospitals is now suffering with these long-term patients who, if they had easier access and more affordable access to preventative care, could have prevented them being admitted to the hospital in the first place with these devastating diseases. Yeah.